Hi everyone, and welcome to Health Equity Teachers video on care for unemployment and occupational health. My name is Colleen Wong. Let's get started. So here are the learning objectives for this module. Describe the impact of unemployment on psychological and physical health. List and summarize the state assistance programs and protections available for people who are unemployed. Describe how work, including physical stressors and environmental exposures, can influence health. Review preventative and therapeutic interventions for environmental and occupational illness. Describe how one's health influences their work, and identify how to help vulnerable populations find jobs. Before we get into the impact of unemployment, I want to define what unemployment means in terms of the Bureau of Labor Statistics. So firstly, the labor force are those who are either employed or unemployed, and so this does not include those who are not unemployed. What does this mean? It means that to be considered unemployed, you are jobless, but additionally are available to work and have actively looked for work in the past 4 weeks. So those who are, say, retired, full-time students, unpaid caretakers, etc., are not considered unemployed. There's also this idea of underemployment. So those who are underemployed maybe have involuntary part-time employment, so their employer doesn't offer them enough hours, or they have poverty wage employment or otherwise insecure employment. And we'll discuss this idea of underemployment and insecure employment in a few slides. Now that we have discussed what unemployment is, let's move on to the impacts of unemployment on one's health. Overall, unemployment has been shown to have negative impact on well-being, including life satisfaction, domain satisfaction, and physical health. A domain satisfaction is an appreciation for a particular aspect of life, and the domains most often studied are job satisfaction, health satisfaction, and marital satisfaction. There are also higher rates of stress-related illness in those who are unemployed. Illnesses include hypertension, stroke, MI, heart disease, and arthritis. Unemployment has also been shown to have a negative effect on mental health. And this is at least in part due to the cascade of secondary stressors that often accompany unemployment, such as worry, uncertainty, financial, familial, and marital difficulties. And along the same lines, there are higher rates of suicide in the unemployed compared to the general population. Those who are members of vulnerable populations, such as low wage, migrant, minority, recent immigrant, or older workers, are particularly vulnerable to the negative impacts of unemployment. At least in part due to the negative impacts on health and well-being, but also to help connect patients to resources and benefits, it's important for clinicians to screen patients for not only unemployment, but insecure or underemployment as well. Some questions that can screen for unemployment and insecure employment are: what is your current work situation? And the answer options should include unemployed, part-time or temporary work, full-time work, or otherwise unemployed but not seeking work. So the otherwise unemployed but seeking work category would apply to students, those who are retired, caretakers, etc. Another screening question would be, are you at risk for losing your job? Are you worried about losing your job? And these two questions bring up the idea of insecure employment. And another question that is helpful for screening is, at any point in the past 2 years, has season or migrant farming work been you or your family's main source of income? So, you've identified people who are unemployed or currently have insecure employment. What are some resources to help? There are government benefits that can help unemployed people and their families cover living expenses. Government benefits are available to help pay for food, housing, and home energy, so heating, and healthcare through Medicaid and CHIP. There is also unemployment insurance, or what is sometimes referred to as unemployment or unemployment benefits. And this is a stipend given either on a weekly or monthly basis. There's also temporary assistance for needy families, TANF, and this is a federally funded state-run benefits program, also known as welfare. TANF helps families achieve independence after experiencing temporary difficulties. Now, for all of these programs, there is an application process and eligibility requirements. These programs have different requirements based on the individual program and the state that you're in. All programs have income limits, and most programs require you to be a U.S. citizen or an eligible non-citizen. This means that those who are here without legal status may not be able to access these services. Many programs have other state requirements too, including family size and other financial resources. That being said, the application process for these services can be cumbersome, and different eligibility requirements can change or be waived in certain situations. And this makes obtaining these benefits difficult, especially for those who have a hard time navigating our bureaucratic system. Now, I want to move on to how work influences health. In a few slides, we're going to discuss how your health can influence your work and productivity. I bring this up now because I want you to see how it's really a two-way street. Work influences health, and health influences work. So, in many cases here in the US, health insurance is provided through employment. And two key functions of health insurance are access to affordable medical care and financial protection from unexpected healthcare costs. Many employers also offer paid sick leave, and this serves as a buffer to allow employees to seek medical care without the fear of losing wages. In addition to sick leave, many employers offer parental leave. Now, the policy surrounding parental leave, so maternity or paternity leave, differs depending on the employer and even the location, but this leave is often unpaid here in the US. Even so, maternity leave has been associated with positive outcomes for women and children. It's pretty easy to see how the presence of these insurances and leaves can influence health in mostly positive ways. But there are many other factors too, especially in relation to exposure, that can influence health, perhaps in not so positive ways. Occupational and environmental hazards in and around the workplace can influence health as well. In terms of inadequate facilities, heat and cold exposure, chemical exposures such as lead, tobacco, and air pollution, as well as biological hazards such as pests and mold, can all influence health negatively. In the workplace, there can be chemical exposures, accidental injury, and heat stress. Of course, work does not happen in a vacuum, and the area surrounding one's place of employment can also affect one's health. The food that's available, the presence of violence in the neighborhood, the lack of green space, and the presence of outdoor pollution can negatively impact health as well. There are certain individual factors and social vulnerabilities that make one more susceptible to environmental and occupational hazards. For individual factors, age, gender, the presence of comorbid disease, genetic factors, individual stress, and economic hardship, as well as the job training and use of personal protective equipment, can make someone more or less vulnerable to occupational hazards. On the social vulnerability side, one's race and ethnicity, if they're dealing with social isolation, and different social statuses can influence one's susceptibility to hazards as well. Importantly, these factors are oftentimes influenced by the type of employment one has, and these factors have often been shown to influence health in and of itself as well. Here are some common pitfalls that experts in the field of occupational medicine have identified. Those from poor and minority groups are at high risk for fatal and non-fatal work injuries and violence. Construction, migrant farm work, taxi cab driving, and retail sales in small, all-night stores are dangerous occupations. Morbidity and mortality resulting from respiratory and cardiovascular disease are strongly associated with poor housing and urban air pollution. Healthcare providers often do not assess occupational and environmental risk. Interventions are suggested infrequently by healthcare professionals. And so, since providers often do not assess for occupational risks and often do not suggest interventions, this is one area that we can improve on. Each clinical encounter with a patient provides an opportunity to assess environmental and occupational health risks. Some screening questions are, what kind of work do you do? Do you think your health problems are related to work, home, your neighborhood, or another location? Are your symptoms better or worse when you are at home or at work? And what hobbies do you have? If the patient you are seeing is an agricultural worker, You can ask, are pesticides being used at work? Were the fields wet when you were picking? Did you get sick during or after working in the fields? And if the screening questions or the clinical encounter suggest potential occupational or environmental exposure, a detailed exposure interview is needed. The Agency for Toxic Substances and Disease Registry publishes a guide to taking a detailed exposure history. If no clear risk is identified, healthcare providers should still provide general preventative advice to maintain occupational and home safety. Now, in terms of therapeutic interventions, the general guidelines are: consider whether the signs, symptoms, and timing make sense for the suspected exposure. Perform a complete history and physical examination to exclude other etiologies. And ascertain whether other people who spend time in the workplace are also ill in order to identify and reduce high-risk exposures and to prevent further spread of illness. Usually, occupational injuries and illnesses are required to be reported by the employers, but this may be different depending on the type of exposure, the state that you're in, and the patient. Additionally, patients may have certain forms and paperwork that their doctors need to fill out. Now that we have talked about how both unemployment and employment affect health, let's discuss how health influences work. It follows common sense that healthy workers are more likely to have lower medical costs and be more productive. And so good health is often needed for employment, particularly for low-skilled workers. Additionally, those with more health conditions often have absenteeism, disability, and overall reduced productivity. So now I want to switch gears a bit and talk about employment search. I think many of us know about Indeed, Monster, LinkedIn, and other online sites that can help the general public find jobs that they're looking for. Certain vulnerable populations have more difficulties finding jobs, and two populations that come to mind for me are the formerly incarcerated and those who speak limited English or no English. In both cases, there may be job finding assistance programs available. To find or access these programs, you can look on findhelp.org or on the Department of Labor site for your state. Additionally, many states, including Connecticut, have a 211 page dedicated to the formerly incarcerated, with links to resources to find jobs in that state. There is also a published list of companies who are known to hire ex-convicts or those who were formerly incarcerated. I have the list linked here, and it will be available on the syllabus as well. For those with limited English proficiency or no English, there are jobs available as well. And here are the references for this module. That concludes our module on unemployment and occupational health. Thank you.